There's many products on the market which claim to be able to lighten your skin, but do any of them actually work, and what are the safety implications of using them? I recently saw this headline, and I definitely think in South Asian or in some communities, being fairer is associated with more socioeconomic wealth, better job prospects, better marriage prospects. So what are the truth behind these ingredients in these skin bleaching treatments? Often we find that ingredients include mercury, hydroquinone, steroids, and these can all have potential side effects, especially with prolonged use. Skin bleaching usually refers to the use of products to lighten your overall skin tone. These products can come in creams, soaps, tablets, sprays, lots of different methods. When we're born, we're programmed to be a certain colour, and this is part of our DNA. This is really hard to change, and this will be your colour throughout your life. If we are naturally one colour and we go in the sun and we get hyperpigmentation, melasma, we get a tan, these changes are easier to reverse. Normally ways of reversing this is chemical peels, lasers, and this is reverting your hyperpigmentation or your excess colour from melanin back to your normal colour, which is your baseline colour. So it's different to lightening your overall skin type. When I was in Namibia, I got a lot of sun exposure, and this means my skin colour definitely changed, it got darker. However, it does revert back to its normal type, and that's often with using sunscreen, using brightening products like vitamin C and niacinamide. You do generally go back to your baseline colour if you avoid getting tan in the future. If I'd stayed in Namibia, I might be a different colour to what I am now. When I was young, I definitely heard terms like don't go in the sun for too long, you'll get really dark. In the South Asian and African communities, it's generally thought that lighter skin tones have more socioeconomic prospects, so job prospects, marriage proposals, they have a better financial life. It's therefore believed with lighter skin types, you'll have more personal and professional success. How do skin lightening treatments work? Well, skin lightening treatments aim to disrupt the production of melanin. Melanin is what gives your skin colour. This is where the pigment comes from. There's chemicals like mercury, hydroquinone, high-potent steroids, and these can all have serious side effects. In this study by Northwestern University, the most surprising finding was the lack of awareness of ingredients in products being purchased over the counter and their potential detrimental effects. In 2020, the FDA reported serious side effects from the use of hydroquinone, such as skin color changes, rashes, and facial swelling. In this table here, you can see the different strengths of mercury and hydroquinone in different over-the-counter products. Often mercury and hydroquinone was not declared on the label. There have been cases in which people exposed to the products have had mercury poisoning or elevated levels of mercury in their bodies. Symptoms and signs of mercury poisoning include irritability, shyness, tremors, memory problems, changes in vision and hearing, numbness and tingling in hands. Another component in skin bleaching treatments often includes potent steroids. In this study done on India, out of the 6,700 patients, they said the main reason for using topical steroids was to lighten skin colour and treat melasma and suntan. Acne was the most reported side effects. Topical steroids are used in skin lighteners due to their potent bleaching actions and the anti-inflammatory activity, which can reduce the risk of dermatitis, which is a skin complication, when used with other irritating skin lightening agents. So often we find that steroids are mixed in with these skin lightening ingredients to reduce the risk of dermatitis or skin reactions. Unfortunately, they found that the steroids used were often potent or very potent steroids. Bruising, thinning skin, diabetes, Cushing syndrome. How do dermatologists lighten your skin? Well, if you have a condition called melasma or hyperpigmentation, hydroquinone is used, and it is an effective treatment against melasma. It's important to note when a dermatologist gives it, they're aware of strengths for your skin tone, they're aware of side effects, they're aware to look out for irritation or any problems that you're having on this treatment, and to avoid prolonged use. As dermatologists are trained to manage complications and give advice to you on the right strength, they can avoid these side effects. If you buy these ingredients over the counter and they're not monitored by dermatologists, that's when you will get the side effects. What are over-the-counter methods to lighten your skin? If you've got hyperpigmentation or a tan and you want to go back to your normal skin type, that's when skin lightening or skin brightening treatments can be bought over the counter safely. Often they can include ingredients such as vitamin C, niacinamide. These can help increase the radiance of your skin, and it's something I use in my routine regularly. When I'm in the sun for prolonged periods of time, I notice I get hyperpigmentation here, and generally if I start to use sunscreen, vitamin C, and make sure I am looking after my skin, the hyperpigmentation will go away. In this case study, it looked into a 29-year-old who was using topical hydroquinone recommended by a beautician to her. She used the cream regularly for 2 years and this led to a lighter complexion. However, when she stopped, she noticed the pigmentation came back. So she decided to continue using the cream, and the pigmentation persisted and became more prominent. In the end, she was diagnosed with a rare condition called. It's important to be aware of these rare side effects because prolonged use can lead to permanent pigmentation. This condition can present as a bluish-black pigmentation in places where you're applying it, places like your face or your arms, so places exposed to the chemical. Nigeria has declared skin lightening as a health emergency. Skin lightening is a billion-dollar industry with serious health implications. The dangers of pregnant women were even being sold these products and being told that they would help lighten the colour of their unborn baby. In fact, there's even been reports of these creams being used in 5 and 6-year-olds and children coming in with skin complications as a result of these creams. Thank you for watching this video on the effects of skin bleaching treatments. So the key things to take away are, is it skin lightening or skin brightening? Skin brightening might include chemicals like vitamin C, vitamin A, niacinamide, which can all help with making your skin look brighter and healthier. However, if it's skin bleaching, it can include chemicals such as mercury, hydroquinone, high-potent steroids, and these were not licensed for long-term use, especially for the use of skin bleaching. When a dermatologist uses products like hydroquinone, they check the strength, they're aware of your skin type, they're aware of potential complications, and they can monitor you. If you are buying a product and there are no ingredients on the list or the packaging, then don't assume it's safe. They might have left it out for a reason. When you are going to buy products from the pharmacy, make sure you look out for ingredients such as. So if you love the skin you're in and you don't want to have any of these serious complications, it's best to avoid these products. Thank you for watching The Travelling Duck.